Acute low back pain usually is something that's going to happen to probably 8 out of 10 of us, and it's something that typically happens in the springtime. We're doing yard work all of a sudden, or we're doing some house cleaning, or we're moving furniture in and out of a room, and we're doing some unexpected bending and lifting and moving in positions that aren't always really ideal, and probably positions that are different than what we do in everyday life. And we sprain something or strain something in our back. Low back pain, generally speaking, is going to involve tissue in the lumbar spine and the sacral area. It can involve the bony structure of the spine. It can involve the muscles and the tendons that lie over top of the spine in a very complex layer of tissue. It can involve the little nerve roots that peek out from the spinal cord. It can involve the discs themselves, which are shock absorbers between the bones of the spine. So we have joints in our spine, just like we have a hip joint and a knee joint, a shoulder joint, that's encapsulated and has fluid in it that can also be a pain source. So that joint can become arthritic in the same manner I might have hip or knee arthritis. The chances are very good that we're going to treat them in 1 to 3 sessions with just mobilization of the back and the soft tissue, and they're going to feel 100% better. That second person with acute back pain who may have been lifting too much or bending incorrectly or both, those people typically, if that symptom hasn't resolved for them over 2 weeks of sort of relative rest and walking, then I may be seeing them for 2 to 4 to 6 weeks, depending on what their previous conditioning level was and how well and how willing they are to buy into the program. You are going to be exercising while you still have some discomfort, and that's a big leap for some people to want to exercise despite pain, even though we may be keeping that pain in a very controlled fashion.
I was a marathon runner when I realized that I had some hip issues, and we had realized that I had hip dysplasia. So I ended up having to have a surgery for the hip, which actually created complications in my back because people recognized how much progress I had made in such a relatively short amount of time. And the answer was always Allegheny Chesapeake Physical Therapy, and specifically Jessica, who was working with me. They are willing to do anything and everything, go above and beyond just the practice of physical therapy to make sure that they're not just meeting the needs of the problem, but the patient.